So 22.4% of Arkansans are smokers. That's 720,000 people. We're fourth in the nation in smokers. According to research done by Troy Moret through the Small Business Administration, 5% of those people started smoking using an advanced personal vaporizer in 2013. That's 36,000 people who tried. That number jumped to 10% in 2014, so that's 70,000 people. If the trend continues, we can expect that to double in 2015 to 140,000 people. So in 3 years, almost 250,000 people who we know at least tried using an advanced personal vaporizer. That's a third of the smokers that we have in Arkansas. Now, we don't know if they ended up quitting smoking or yet, but if that 60% study that I cited earlier holds true, by the end of this year, 150,000 Arkansans will have quit smoking due to vaping. We will have reduced the number of smokers in the state by 25% in 3 years. This is something that no gum, patch, pill, or quit line can claim. Imagine the impact to our state's public health if this trend continues. And I just can't imagine how the Arkansas Center for Health Improvement or the Arkansas Department of Health could possibly be against that. They should be supporting that, and we should be handing these out for free to people on the quit line. Not only that, but the average smoker in Arkansas spends about $300 a month on cigarettes. The average vapor spends $40. That's $260 more in disposable income for a population which earns 20% more than 20% less than non-smokers, according to Forbes magazine. Imagine all of that money pumped back into the Arkansas economy instead of sent to the federal through cigarette tax. So earlier I spoke about vape shops. I'd like to briefly touch on them because they serve as the hub of the vaping community. If you were to lump e-cigs and gas station cigarettes in with vaping and vape shops would make up a very small part of that equation. Any negative economic impact of the industry as a whole would be easily absorbed by the chain gas stations and the e-cig products they sell that are manufactured by the big tobacco companies. However, this bill will absolutely force these mom-and-pop businesses, vape shops, to radically change business, the way that they do business in a way that would certainly put the vast majority out of business, because if this bill would pass, people would no longer be able to vape in vape shops. In Arkansas, over 184 vape shops have opened since January of 2013. Each of them employs 3 to 5 employees. They're good paying jobs at $9 or more an hour. The industry is growing when other industries are breaking, and projected sales for this year in Arkansas is $68 million for vape shops, for those 184 mom and pop shops. So I ask you, let's not pass more government regulations that stifles growth of these small businesses. Let's not do something drastic as adding something that is proven to save lives to the list of something that takes lives. Government should be fostering the growth of this industry, not finding ways to impose upon it. I'm coming to you today not as a lobbyist, but as a citizen. I'm trying to stop this bill. I'm not trying to stop this bill because I'm getting paid to. I'm trying to stop this bill because I truly believe that this bill is going to prevent someone in the future from being able to stop smoking like I did. They say that smoking is more addictive than heroin, and I beat it. And because of that, my little boy's going to have his daddy around a little longer. So I ask that you give other folks the same chance that I had. And in closing, I would say, if you want to make it so that vapors can't smoke or can't vape where you can't smoke, pass a simple bill that says no vaping in non-smoking areas. We're fine with that. We don't do that anyway. If we see a vapor smoking or vaping in the middle of Walmart, we ask them to stop. We don't go to restaurants. We know it's safe, but we don't want to make the couple next to us feel uncomfortable. So I would just ask you to consider those things as we do something as drastic as add vaping or e-cigs to the definition of tobacco. So, as you always say, I would appreciate a good vote.
All right, thank you.
Madam Chair.
All right.